Johanna and Liz, thank you so much for joining us. Johanna, this question is first for you. Where does Takeda lie when it comes to sustainability and climate initiatives?
Thank you, Lisa. So it's great to be here. So Takeda has a long history, and we're a very values-driven organization. So our values, integrity, fairness, perseverance, all helps shape our climate strategy. And our climate strategy is integral to what we do for patients and putting the patients first. So we have very ambitious climate goals. We have a goal to be net zero across our operations by 2035 and net zero across our value chain by 2040. These are some of the most ambitious targets in the pharmaceutical industry. And we're very proud that they were just recently validated by the Science Based Targets Initiative. But with these goals come a big obligation to really drive climate in everything that we do. And at Takeda, we really frame it by our products, our operations, and our value chain. So within our products, we think about our therapies and how climate might touch our patients in terms of the everyday and the ways that they live and deal within their therapeutic areas. And then also we start thinking about where can we play a role with climate-related illnesses, like dengue, for example. So those are some of the things that we're starting to think about when it comes to our products. We're also integrating sustainability design principles into the R&D space. So thinking about our research as well as product development so that we can deliver even more sustainable products in the future for our patients. Secondly is around our operations. So what are we doing to decarbonize our operations? So addressing key areas like Scope 1, Scope 2 emissions. Around Scope 1, we have demand management type work, and we're also pioneering the first industry natural gas-free steam generating heat pump. This is in our Vienna, Austria facility that I actually was able to visit last week. And it's a really fabulous new technology that we really can hope can scale to other areas, not just within Takeda, but even across the industry. And we do hope that that will reduce our emissions by about 80% at that facility. And lastly, the third area that we focus on when it comes to climate and health really is about our value chain. So the first part is thinking about the healthcare ecosystem and ensuring that it's more resilient. So we do have some CSR programs targeted at that to help provide some infrastructure improvements through healthcare entities throughout the world. And the other piece is around decarbonizing our value chain. So starting to think about up and down our value chain and how we can partner with suppliers, customers, and other organizations that support the healthcare ecosystem to finding solutions to reduce our emissions. And we at Takeda are also focused on thinking about innovative partnerships when it comes to tackling our value chain emissions. We know that with some of our most ambitious targets, we need to start finding solutions now if we want to see a result in 2040 and beyond. So we're starting to kind of think about how we can catalyze some investments in value chain emissions, thinking about product packaging, medical waste, cold chain packaging, really starting to come up with solutions that are not available today or not even scalable today. So we're starting to kind of drive some potential collaborations or even through a grant challenge that we have with Mass Challenge, which is a global organization that we now have an active call for grants to try to find some innovative solutions to these emissions hotspots. So we do hope that through catalyzing some of this work, we can start seeing a ripple effect across the healthcare community.
And speaking of healthcare and healthcare companies and pharma, Liz, what role do they play in this fight against climate change?
So healthcare players have an enormous role to play. And first and foremost, because really the climate crisis is a health crisis. As the WHO has said, it's the foremost risk to public health of the 21st century. So for that reason, healthcare players have such an important role to contributing to decarbonization. Really, 4 to 5% of global emissions is driven by the healthcare system broadly. So, and even in countries like in the US, that can be even greater, up to 8%. So companies like Takeda and others have a very critical role to play in helping drive the decarbonization, not only in their own operations, but as Johanna described, across the entire value chain, because really the vast majority of the impact is upstream or downstream of the individual companies. And so when you think about the influence that a pharmaceutical company like Takeda can have on bringing along all of those suppliers, it's a very complex supply chain to manufacture pharmaceutical products, but also medical devices and the broader healthcare services that are provided. So really critical to ensure that these companies are helping really drive that through the chemicals companies, the packaging companies, and everyone else that's upstream, as well as partnering with the hospital systems that are downstream to think about the waste impacts, for example, and how there can be more circularity and medical waste can be addressed in a more sustainable way. So a big role for the players to play there. And the one other thing that I would add is when it comes to the health impacts of climate change, Johanna was speaking about that as well. Really, it's a huge opportunity for companies to think about how to evolve the services and products toward addressing the health risks that are going to continue increasing due to climate change. And so thinking about adaptation and resilience and even preventative care to get ahead of those types of health impacts, which we know are already happening and are likely to increase as the climate continues to warm.
Thank you so much.